It's Dr. Karen with this week's Hot Topic. Make sure you like this video, follow us on social media, and subscribe to our YouTube channel so you never miss another hot topic. So this week I want to talk to you about a mouthful of a thing, but this is called a postural orthostatic tachycardia syndrome. So in the rest of this video, I'm just going to call it POTS. Otherwise, I'll probably do this little tongue twister. So POTS is a condition that affects blood flow in general. So if you had to describe it, that's what it would be. It's a form of like orthostatic intolerance. So basically what that means is just more of a development of symptoms that come on when you stand up from a seating position or a reclining position, and that may be relieved by sitting or lying back. So it's typically this positional thing where you notice a big difference as far as your circulation is concerned. So the primary symptom that somebody might notice from POTS is more of like a lightheadedness, fainting, and an uncomfortable rapid increase of heart rate. So that's where that tachycardia comes from. So if you ever heard that word, that's what that increased heartbeat is tachycardia. So heart rate and blood pressure, they do work together to keep the blood flowing. So at a healthy pace, no matter what the body position is, it should always stay pretty standard. So that's normal. Now, people with POTS, they can't coordinate that balancing act between the vessel squeeze and the heart rate response. So that's why this blood pressure just can't keep this steady and stable. So the lightheadedness, and you're just like, whoo, I feel really woozy. That's what I'm talking about. So there are various forms of POTS. So the most common ones are the neuropathic POTS, so which is more of the peripheral denervation, which is the loss of nerve supply, which leads to poor blood vessel muscles. So this is more common in legs and the core body. So you have also a hyperadrenic POTS, which is more of the overactivity of the sympathetic nervous system. So the adrenals, I've talked about this with cortisol. Low blood volume of POTS, which is just a reduced blood volume that can lead to POTS. So a low blood volume can more similar symptoms, which is more of the overlap of the neuropathic and the hyperadreneric. So that's kind of a mouthful, but hypoadrenals basically. So what are these symptoms of these POTS? So patients typically with POTS, they usually suffer from 2 or more of these more common symptoms, but not all patients with POTS have these symptoms. So just kind of keep this in the back of your mind. If you have these weird symptoms and you can't really understand what they are, it could potentially be this. So high blood pressure, low blood pressure. Can be one or the other. High or low heart rate, so you have that racing heart rate. You can have chest pains, dizziness, and lightheadedness, especially when you stand up for prolonged standing in one position or when you're going on long walks, so something that you might be moving your head a little bit, fainting or near fainting for just no apparent reason, extreme exhaustion or fatigue. There's also abdominal pain, bloating, and nausea, temperature deregulation. So it's like if you're having a hard time either with being hot or cold, you tend to be nervous or more jittery feeling for no apparent reason, forgetfulness and trouble focusing, so more of that brain fog. We've talked about this in lots of other videos, but blurred vision, headaches, body pain, aches and pains, more of like a flu-like in your neck, insomnia and frequent awakening from sleep, and that can cause those chest pains and racing heart during your sleep, specifically during sleep with those heart racing, and excessive sweating at night. So you can have that shakiness, the tremors, especially with like an adrenaline surges. So when you get super excited, discoloration of your hands and your feet, you have exercise intolerance, excessive or lack of sweating, diarrhea, and constipation. So it's typically one or two or more of these symptoms that I talked to you about. So what are ways that you can actually help manage POTS? So one of the big things is diet and nutrition. So you want to increase your the sodium amount in your diet to like 3,000 to 10,000 milligrams per day. Drinking water is huge. So pretty much anything, drinking water is a good thing. So small and frequent meals, they're more tolerated by people who have POTS and the symptoms. More specifically, a diet with high fiber and complex carbohydrates, which can help reduce those lower sugar, glucose spikes, and can also help lessen those symptoms. So if you have these, you've managed it. So what are some things that you want to monitor it? So first thing is you really want to make sure you check your blood pressure and your pulse daily at the same time. So if this is morning and after dinner, those are usually the best times. You want to make sure you check your blood pressure when you aren't feeling well as well. So you want to make sure there's any differences. Now for your heart rate, a normal rate is between like 60 and 100 beats per minute. So if you have that fast heart rate, it's typically over 100. So that's that tachycardia that I had mentioned. And a slow resting heart rate is more of those 60 beats per minute or below it, and that's called bradycardia. So you may have heard those two terms. High or low rates, which cause the symptoms of POTS. So again, pay attention to your pulse. That's super important. Now, blood pressure, if you don't know what that is, that's just the blood in the blood vessels in your circulatory system, and that is related to your heart beating and the diameter of the elasticities in the arterial wall. So that's why it's super important to make sure you're checking your pulse and your blood pressure. So your blood pressure, it has two components, your systolic and your diastolic. So it's recorded something over something. So that systolic number is the amount of pressure, so how hard your heart has to work. So your arteries are pumping blood and the contraction of your heart muscles, which is your heartbeat. And then your diastolic number refers to when your heart gets to rest. So it's what's happening to your blood pressure between your heartbeats. So typically a normal one, the systolic numbers want to be between 90 and 120, and then your systolic, which is the bottom, will want to be between 60 and 80. So 120 over 80 is pretty typical, what you'd consider normal, that the gold standards. So really to kind of lower those and make sure everything is good is exercise. I've talked about this in many other videos, same thing with sleep. All those things. So you kind of want to make sure that you have those kind of under check. So how is this treated? So medications like salt tablets, you might have medical compression socks, so that the compression stockings will help push the blood flow from your legs, which can reduce some of those symptoms. And really you should always maintain your blood pressure, check your pulse, all those things so you can see if there's a major issue. And again, blood pressure machines, they don't have to be anything super fancy. You can pretty much get them online or at stores, medical supply stores, Walmart, Target, anything like that. And the last thing that you want to do is, even though your heart is healthy if you have POTS, so it's not you have a heart issue or anything, sometimes being evaluated for a cardiac rehab program is something that can be super useful because it can improve your health and to control some of those POTS symptoms that you might have. So you can collect a lot of data from that cardio rehab if you're going through it. So hopefully you gained some knowledge. That was just a general overview of POTS. So if you have some of these weird symptoms, especially when you stand up or sit down and you're like, whoa, I don't know it, and it's not coming from your neck, it's not coming from other things, potentially POTS could be what you have going on. But don't just assume you have it, although part of it is diet and exercise and water and making sure your sleep are good things. So those aren't going to hurt you, but don't just jump to any conclusions. But potentially this could be something that you might have going on, or you want to do a little bit more research. So hopefully I didn't talk your ear off, but that's all I got for you guys this week. I will see you guys next time.